We're taking a live look at New York City for you this morning, 20 after 9 it is in New York. And there is a very quiet Times Square. And for good reason. I mean, New York State under a major lockdown. New York State, Washington State, California, 3 states very hard hit as the country faces a grim milestone with cases topping 32,000 over the weekend. The governor of New York, that's Andrew Cuomo, who's been very strong in leadership on this story, he has predicted that up to 80% of people in New York State will become infected with COVID-19. Hence his urgent calls for more equipment. There are reports of another outbreak at a nursing home in Washington State, and that has been a real flashpoint there as well. So our chief correspondent in Washington, Susan Ormiston, is looking at the overall picture in the United States. And Susan, the numbers just go up and up and up as more and more testing is done.
Yeah, it's watching that ticker of virus cases go up on the weekend was alarming and sobering. And the Surgeon General this morning said this week things are going to get bad. And as you noted, there is desperation and frustration in those hard-hit states, California, New York, Washington State, over urgent supplies. The mayor of New York said they'll run out of masks in 10 days if they can't get those supplies moving. Constant complaints that the federal government is not doing enough to free up those resources, and they're left to bid on them with the rest of the world. The governor, Cuomo, said on the weekend that price gouging is happening. A mask that used to cost 85 cents is now in some cases going from $7. So they're all in this trying to get more supplies. And the National Guard are being sent out to Washington, California, and New York. In New York, they're transforming things like the big Javits Conference Center, Heather, into thousands of beds, a new medical facility, and the National Guard is going to help develop that and help with the healthcare at that site. Now, all this, as the president tweeted last night at midnight, quote, "We cannot let the cure be worse than the problem. And at the end of 15 days, we will decide which way we want to go," musing that maybe the restrictions that everybody's talking about might be eased in a week's time, because this was last week they started the 15 days to stop the curve or flatten the curve. And this is going against all the medical advice in the United States. So really startling that he would suggest that last night in a midnight tweet.
Health crisis meets economic crisis, of course, that's the story globally. And as far as the U.S. economic response today, I understand, Susan, there's going to be a vote in the Senate on a massive stimulus package. Bipartisan accord still in scarce supply. Democrats and Republicans could not agree on key components to this yesterday. Where are they now in their talks? And really, what's at stake here, Susan?
Well, everything's at stake. Everything. There's estimates that 2 to 3 million Americans may have been unemployed last week. They may have filed for unemployment benefits. Now, they're talking again on that bill. There may be a vote at 1 o'clock, we're hearing, but that could be delayed. And they're at odds over basically what the business bailout will look like. The Democrats suggesting there aren't enough guarantees, that it will go to workers and not to Wall Streets. They want more unemployment insurance, more restrictions on executive pay increases. And here's what Chuck Schumer had to say.
The legislation has many problems. At the top of the list, it includes a large corporate bailout with no protections for workers and virtually no oversight. This is a public health crisis. It is inexplicable to skimp on funding to address the pandemic.
Heather, the bill failed last night by 13 votes, not helped by the fact that 5 Republican senators are out in quarantine. One of them has the virus, so this isn't helping their vote count. So we're watching that extremely carefully today. We're talking about staggering numbers, $1.8 trillion US dollars, Heather.
Susan, thank you very much. We'll be checking back with you every morning for the U.S. story. It's so important.